topic is a very basic one, that is complete blood count and peripheral smear examination. Now, in this class, I'll talk about what do you mean by CBC, what are the parts of CBC, and what is peripheral smear examination, and how we do it. Okay, so let's move further. See that. What is CBC? CBC means complete blood count. This is a very essential part of our investigation. Whatever happens to the patient, especially fever, okay, if you suspect infection or inflammation, you always order CBC, always. And not only infectious disease, in so many chronic conditions in the body, we order CBC just to make sure what is happening to hemoglobin level, what is happening to total count, what is happening to platelet and things like that. So these are included under complete blood count, like, see there, red blood cell count, white blood cell count, hemoglobin level, hematocrit, and platelet. So these are the basic parts of CBC. If you order CBC in any lab, these are the report they will provide to you. So RBC, WBC, hemoglobin, hematocrit, and platelet. Now, hematocrit means the proportion of red blood cell to the fluid component or plasma. It is also known as packed red cell. Packed red cell means only the red cell component is called hematocrit. The CBC tests also provide information about the following measurement, but we don't want this type of measurement in every case, okay? But some of the lab are routinely providing this also as part of the CBC. These are MCV, MCH, and MCHC. Now look at the meaning of this. Average red blood cell size is called MCV. Mean corpuscular volume. Mean corpuscular volume is MCV. This means what is the average size of each red blood cell. Now, okay, please mute yourself. If the size of the red blood cell is big than the normal, we call it macrocyte. Macrocyte. If it is normal, we call it normocyte. If the MCV is lesser than the normal, we call it microcyte. See that? So we'll talk about this, okay? Because you have come across the new term, so I'm explaining it right now. MCV determines what is the size of the red cell. Another is MCH, mean corpuscular hemoglobin. Mean corpuscular hemoglobin is MCH. Now, what is the meaning? This is hemoglobin amount per red blood cell. In each of the red blood cell, how much hemoglobin is present? That is called MCH. And MCHC, mean corpuscular hemoglobin concentration. Mean corpuscular hemoglobin concentration. Corpuscle means cell. Okay, we're talking about RBC here. Now, the amount of hemoglobin relative to the size of the cell is called MCHC. This is per red blood cell. The amount of hemoglobin relative to the size of the cell is MCHC. So this is a relative thing. Remember that. Sometimes what happens if the size of the cell is smaller, now MCHC may be higher in that. And if the size of the cell is bigger, MCHC may be lesser than the normal. These are very important to find out. Okay, what type of anemia is there? We'll talk about that later in the classification. Anemia are classified like macrocytic anemia, normocytic anemia, and hypochromic anemia. So these classifications or these parameters are very important one. Now, let's move further. One of the basic thing every student should know is how to collect blood sample in the lab. If you are interested, you can go to the lab during your internship and practice how to collect the blood sample. Or in the inpatient, okay, you can collect right there in the patient bed also. So this is a whole blood collection, and it is collected or drawn into a vacuumized, okay, tube. A vacuumized tube. It's a purple top tube which is used very often, and it should contain an anticoagulant. The name of that anticoagulant is EDTA, ethylene diamine tetraacetic acid. EDTA, very commonly used as an anticoagulant there. We have to use anticoagulant because we are going to study complete blood count. The blood should not clot. But if you are going for serological test, we need to separate the serum from there. Okay, so we don't collect that sample of the blood in EDTA vial. Okay, we allow that blood to clot. So these are the different things here. Now, with this basic information, okay, let me talk about one of the things which you have already done in immunology. Okay, so see here, all of you probably know this already, but this is a very good time to repeat it. Now, inside the bone marrow, okay, we have pluripotent stem cell, also known as pluripotent, okay, multipotent stem cell. Multipotent or pluripotent, it's the same thing. What does that mean? It can differentiate into any type of cell, either a lymphoid cell or the myeloid cell. So that's why we call it pluripotent stem cell. Now, it can develop into lymphoid stem cell. Okay, let's talk about the lymphoid first, and then I'll go to the myeloid one. See there, this lymphoid stem cell will develop into natural killer cell, NK cell, and it will also differentiate into T cell progenitor and B cell progenitor. These are the very primary cell. This T cell progenitor, it will go to the thymus. Okay, thymus. And where is thymus present? Where is it?
Below the sternum.
Below
At the end of sternum.
At the neck, below the sternum.
Inferior mediastinum.
Okay, good. So see that the answers are quite obvious. It is actually present. A part of it is present in the anterior mediastinum, and a part is present in the superior mediastinum. Now remember, this mediastinum is the space between the two pleural cavities, and this mediastinum is divided first into superior and inferior one. And inferior mediastinum is again divided into three parts: anterior, middle, and posterior. So this thymus gland is mainly present in anterior mediastinum, which is a part of inferior one. A small part also is located to the superior mediastinum. Now, listen properly. This thymus has a huge role to play for the development of T cells. Those T progenitor cells will move on to the thymus gland, and they will mature there. They will get matured up inside the thymus. And all the T cells which go to the thymus will not come back to the circulation. They are selected. Which T cells should go back to the circulation? Thymus gland will decide that and send only those selected T cells as the mature one. Okay, this is so important point. Now we have got two types of T cell: helper T cell and cytotoxic T cell. Helper T cell is also known as, what is another name for helper T cell? Yes?
CD4?
CD4.
CD4, exactly. And cytotoxic T cell is called
CD8 cell.
Very good, CD8. Excellent. So you can safely say CD4 for helper T cell and CD8 for cytotoxic T cell. Okay, so these are the things. Now, this B progenitor also develops from lymphoid stem cell. It will develop into the B lymphocyte or mature into the B lymphocyte inside the bone marrow itself, and it will move on to the different lymphoid system now, mainly the lymph node. It will differentiate into plasma cell, and this plasma cell will form antibody. Okay, so always remember this: plasma cell is the cell which forms antibody, and it is differentiated from the B cell. So roughly we can say B cell or B lymphocyte secrete antibody as well. You are not incorrect if you say like that. So to revise, from the lymphoid stem cell, we have got natural killer cell, T lymphocyte, and B lymphocyte. T lymphocytes are of two types, helper and cytotoxic. Now let's go to the myeloid series here. This myeloid stem cell will develop into different types of cells now, like a granulocyte. Okay, granulocyte or monocyte progenitor. Granulocyte or monocyte progenitor, and from there monocyte is developed and neutrophils is developed. Monocyte and neutrophil. Now, in some of the textbook, it is written this dendritic cell, okay, is a type of monocyte itself. Means monocyte will differentiate into the dendritic cell. And look at the origin; it is the same. The parent cell is the same for dendritic cell and macrophages are monocyte. So don't get confused here. Macrophages are the tissue form of monocyte. In the blood, it remains as monocyte, but when it moves to the tissue, it is known as macrophages. Now, these macrophages are having different names wherever they are present in the tissue. Some of the good example, one or two example I like to take immediately. Okay, in the liver, what is the name of the macrophage?
Kupffer cells.
Copper cell.
Copper cells.
Very good, Kupffer cells. Very good, Kupffer cells. Okay, in the brain, what is the name of macrophage in the brain?
Microglium.
Microglia. Okay, microglia is the name in the brain. Micro, okay, not macro. It is a microglial cell. On the skin, okay, what is the name on the skin when macrophage is present?
Langerhans cell.
Dendritic.
Exactly, Langerhans cell. Okay, Langerhans cell. Dendritic cells are present, you know, in a different area. Dendritic cells are a very important type of antigen presenting cell. So we cannot localize them to a particular site. Actually, they are present in many other areas. Fine. Another is neutrophil. Now, eosinophil progenitor develops into eosinophil. Basophil progenitor develops into basophil. Okay. This megakaryocyte will develop into platelet, and erythroid progenitor develops into erythrocyte. Now we have all other types of cell apart from natural killer cell, T lymphocyte and B lymphocyte. All other are developing from a myeloid series. This is a very important knowledge for you. Never forget. That's why if a myeloid series is having problem, then we are having granulocytopenia. Okay. Then we also have anemia, and we also have thrombocytopenia. This exactly happens in case of aplastic anemia. Aplastic anemia is the involvement of myeloid stem cell. So remember, in aplastic anemia, there is pancytopenia. Lymphocytes are not abnormal there. The lymphocyte percentage is normal, but the myeloid stem cell is damaged. As a result of this, the myeloid series are badly affected. So once again, monocyte, macrophages, dendritic cell, neutrophil, eosinophil, basophil, platelet, and erythrocyte or RBC, all of them are developed from the myeloid stem cell. And one small information, when basophil is present in the tissue, we call that mast cell. Basophil in the tissues is called mast cell. This mast cell is present in a very high number just below the skin or in the subcutaneous tissue, below, okay, the airway mucosa, or in the mucosa of the airway, and in the alimentary tract or GI tract. Mast cell is present in a high number. You don't need to really remember these different cytokine, okay? It will be known later on. Now, let's move further. Let's talk about what are the normal values of these different cells under CBC. Please pay attention. Regarding the RBC count, in male, it is 4.5 to 6 million per microliter. This is microliter. Whereas in female, we have 4 to 5.5 million cells per microliter. So we have, you know, a very increased number of RBC in our blood. Okay. So if RBC count is lesser than normal, what we call that? Yes. What condition is that? When RBC count is lesser than normal? Anybody?
Intro and
Erythropenia.
anemia.
Exactly, it's very simple. This is anemia. Don't get confused here. This is called anemia. When RBC count is lesser than the normal, we call it anemia. Okay, anemia has a broader definition. Hemoglobin is also less, and sometimes the whole RBC count is also less. Now, regarding the WBC count, this is even more important from the a clinical point of view. Look here, 4,000 to 11,000 cells per microliter. In some of the lab, the upper value is written as 10,000. So it doesn't matter. It's just the difference of 1,000. So you don't need to worry that much. And whatever you answer, that will be correct. Okay. So 4,000 to 10,000 or 11,000 cells per microliter is the WBC count. If WBC count is less than 4,000, okay, we call that leukopenia. Leukopenia. And if it is more than 11,000, we call that leukocytosis. So leukopenia and leukocytosis. So let me write those terms here for you. Leukopenia and leukocytosis. Okay. Regarding the hematocrit, see here, in male, it is 40.7 to 50.3. In female, it is 36.1 to 44.3. It depends which reference you are taking. So I already told you, slight difference here and there doesn't make a significant, difference between the references. Okay. Now, hemoglobin in male, 13.5 to 17 gram per deciliter, and in female, 12 to 15 gram per deciliter. In some of the textbook, it is also written as 13. The lower value is 13 in male, and in female, it is 12. Now, there is a good correlation between hemoglobin and hematocrit. Hematocrit is roughly 3 times of hemoglobin. Just multiply this hemoglobin by 3, the hematocrit value would be there. And hematocrit is interpreted as a percentage, whereas hemoglobin is gram per deciliter. Let's move on. Now, what about the red blood cell indices? MCV is 80 to 95 femtoliter. This is the unit of MCV. 80 to 95 femtoliter. MCH is 27 to 31 picogram per cell, picogram, and MCHC is 32 to 36 gram per deciliter. So these are the value. Now, why are they important? Let me immediately clarify them. Whenever I am looking a patient with megaloblastic anemia, megaloblastic anemia is an example of macrocytic anemia. The size of the mature RBC is bigger than the normal. So I look at this MCV value. If MCV is more than 100, this is a case of macrocytic anemia. Though it is written 95, we usually take it 100 as the clinical reference. If MCV is less than 80, we call that microcyte. So let me involve or mention those terms here. Microcyte and macrocyte. When MCV is lesser than 80, microcyte. When it is more than 100, macrocyte. Okay. Now MCH, mean corpuscular hemoglobin, 27 to 31. If it is less, we call it hypochromic anemia. And MCHC, if it is less also, we call it hypochromic anemia because they are measuring the hemoglobin concentration. After this, let's talk about the platelet count. So what is the normal value of the platelet? See here, very important concept for you. This is 150,000 to 400,000 per microliter. We can also call it 150 lakh, okay, 1.5 lakh, sorry, 1.5 lakh to 4 lakh. This lakh is the unit which is not used universally all over the world. It is very commonly used in Asian subcontinent, okay, or Indian subcontinent, I should say. So better to remember like 150,000 to 400,000 per microliter. So this is the platelet count. Lesser than 150,000 is known as, what is the term we use if platelet count is lesser than the normal? Yes,
Thrombocytopenia.
Thrombocytopenia.
very good. Thrombocytopenia. Thrombocytopenia is lesser than 150,000. But let me clarify you once again, in clinical practice, we don't worry that much if it is between 100 to 150,000. When it is dropping lesser than 100,000 or 1 lakh, then I am a little bit concerned. When platelet count is more than 400,000 per microliter, what we call that? Yes, what term we use?
Thrombocytosis. Thrombocytosis.
Thrombocytosis.
Very good. Thrombocytosis. Excellent. Thrombocytosis. And there are different causes of thrombocytopenia and thrombocytosis. We'll talk about that when a particular topic comes. Okay. If I want to include everything now, then we'll deviate from our main discussion. Let's move further. The normal value ranges may vary slightly among the different lab. That's what I told you before. So do not argue with the people who are working there. Don't say, oh, my teacher has taught like that. My reference textbook was mentioning like that. It is not like this. It may vary slightly among the different lab. That is not a major point here, okay? So there are so many other factors which will decide about the interpretation. Let's move on. Now, what is peripheral blood smear or simply blood smear? What do you mean by that? A blood smear is a blood test that gives information about the number and shape of blood cell. So it is a very important examination in the lab. It gives information about the number and shape of the blood cell, which will tell us what type of disease is there regarding hematology system. The blood sample is sent to the lab, and there it is examined under a microscope, or the blood may be examined by an automated machine, which is very commonly used these days. You must have seen in China, okay, or any other lab in our countries also. These days, they commonly perform examination by automated machine. So what do you mean by that? They just take a sample from the patient and put that sample in automated machine. All the readings are given by that machine. So this is one way. Another is under the microscope, they are counting everything. Okay, so this is other way. The smear shows the number and kinds of white blood cells, which is known as a differential count. Let me clarify you once again. We have already known what is total WBC, but there are different types of WBC. The name you already know: neutrophil, lymphocyte, monocyte, eosinophil, basophil, isn't it? So what is the percentage of each of these white blood cells? We need to find it out. This is known as a differential count. Another is abnormally shaped blood cell, which will give us the diagnosis. For example, sickle cell RBC. If sickle cell RBCs are present, then this is called sickle cell anemia. Okay, one of the simple example I'm providing here, and it gives a rough estimate of white blood cell and platelet count also. The total count and the total platelet count can also be done by peripheral smear examination. Now, this is the reference range for adult regarding the total leukocyte count and differential leukocyte count. Okay, total leukocyte and differential leukocyte. Now see there, the total leukocyte is 4 to 11,000. Okay, into 10 to the power 9 per liter. Okay. If I use per liter, it is 10 to the power 9. If I use microliter, then it will be 4,000 to 11,000. So whatever way you want to interpret, it's up to you. But this is a very common way of writing in the exam, or whenever you follow any type of reference, it is given like this these days. So don't get confused here. This is the number of neutrophil. Okay, see this 2.5 to 7.5, 10 to the power 9 per liter. In other words, 2,500 to 7,500 per microliter. This is the neutrophil number. This is the lymphocyte number. This is monocyte number. This is your Snowfall, and this is Basophil. Now, what is the predominant type of WBC in our blood? Yes? What is that? What is the most? What is the most?
Neutrophils.
Exactly. There's no doubt. There is no doubt. Neutrophils are the dominant or predominant type of WBC in our blood. Look at the number here. Out of 4,000 to 11,000 WBC, we have 2,500 to 7,500 neutrophil itself. And after that, it's lymphocyte, then monocyte, eosinophil, and then basophil. Now, we are talking about pediatric, discussion now under the pediatrics. So it is very essential to know about the pediatric value as well. Okay, so let's focus on this. Right at the birth, look at this value here. Hemoglobin, this is denoted in gram per liter, but you can also denote it in gram per deciliter. Okay, so if you say gram per deciliter, it will be 14 to 24. But in gram per liter, 140 to 240. Now, just compare this hemoglobin with the adult one. So which age group has higher hemoglobin? Which age group? Is it very small babies or the adults which have higher hemoglobin?
Adult have IU.
Now, definitely babies. Definitely babies. Look at the higher range in the baby. It is 24. In adult, the maximum or the higher limit or the upper limit was just 17. Okay, so it is till 24 in case of newborn baby. Now there is a reason behind this, and the reason is, anybody can tell me that reason? Let me hear some answer, then I'll explain. Anybody? Why a newborn baby has high hemoglobin? Why? What's the reason?
Because of
Because
low
the
blood volumes.
Mhm.
Sir, the blood cell formation occur in the every bones, and when it become adult, the erythropoiesis occur only in the lung bone.
Yes, sir.
Okay.
Basically, sir, there are multiple sites for erythropoiesis, sir, in the newborn. But sir, when a person gets adult, sir, there's only one site for erythropoiesis, sir. That's why.
Okay. Good.
Fetal,
Yes.
sir, fetal hemoglobin take less amount of oxygen. That's why amount of oxygen which carry to the baby is increased by increasing hemoglobin level.
Okay, good. So see that so many different answers are coming, and some are very near to the correct answer. So let me clarify this. Very important question from the pediatric point of view. Now, the question is, why a newborn baby has very high level of hemoglobin? Now, to answer this, you need to go back to the intrauterine life. Now, remember, in intrauterine life, the condition is relatively hypoxic. Okay, we all know that. If I compare the oxygen saturation, okay, of the blood which is going to the baby and the oxygen saturation of the blood after the birth, it is different. That is one point. So intrauterine life is relatively hypoxic life. That's the first point. Second, during the fetal life, the baby is having fetal hemoglobin, and there is a big difference between adult hemoglobin and the fetal hemoglobin. Okay, so fetal hemoglobin will bind to the oxygen very readily, and it doesn't unload the oxygen that quickly as adult hemoglobin. So what does that mean? At the tissue level, there is hypoxia. So in both situations are causing hypoxia inside the intrauterine life. Whenever there is hypoxia, there is erythropoietin release by the kidney. Erythropoietin can be released by liver also a little bit, but mainly by the kidney. Now that erythropoietin is producing more RBC from the bone marrow. That's why inside the intrauterine life and right at the time of birth, okay, the hemoglobin level is very high in the newborn. Now, when this baby becomes, bigger, week to week, this hemoglobin gradually decreases. Okay. Now, there is also a reason for that, because the baby is breathing. There is enough oxygen in the blood, and the baby doesn't need that high hemoglobin now. So this RBC will slowly decreases, or hemoglobin concentration will fall, and ultimately it will reach to a lowest level. Okay, that is known as physiological anemia of infancy. I will talk about that later. But this is the reason why at birth there is high hemoglobin. Okay, now let's focus here again. Look at the RBC. This is also a little bit higher. Hematocrit is definitely high. When hemoglobin is high, hematocrit would be high. Look at the WBC count. I want all of you to focus here. See, look at this. It is 10 to 26, okay, multiplied by 10 to the power 9 per liter. So it is 10,000, okay, to 2,600 WBC per microliter. So WBC count is also very high at the time of birth. This is explained by the stressful situation at the time of birth. It's a stressful condition. And during a stressful condition, we talked about this before, cortisol hormone is released, and that cortisol will, mobilize the different type of WBC in the circulation. That's why the WBC count is higher, which gradually decreases when the child becomes older. So this much information I like to share here. Let's move on. Now, according to the percentage, what is the percentage of these different WBC? This is known as differential leukocyte count, or DLC. Neutrophil consists of 40 to 60%, lymphocyte 20 to 40, monocyte 2 to 8, eosinophil 1 to 4, basophil 0.5 to 1%, and band cell, which are also known as young neutrophils, comprises of 0 to 3% in some of the portion, not all. Okay, they are a part of a neutrophil count in infectious situation. If there is acute bacterial infection, then band cells will be seen. So clearly neutrophil is 40 to 60. Now with this, let's move further and see some of the picture here. This is the normal peripheral smear, how it is seen. Now just focus here and try to identify which cells are there correctly. Now, which cell is this? Just identify this cell. Which cell? Which I am showing. Which cell is this?
Monocytes.
Monocyte.
This is lymphocyte. Okay. Now it is quite natural to confuse between monocyte and lymphocyte, because both are mononuclear cell. They are a single cell. There is one difference though. Monocyte nucleus is like a kidney shape. It is slightly indented, kidney shape. This is a rounded nucleus. So this is a lymphocyte. What cell is this? This one.
Neutrophil.
Neutrophils.
This is exactly. There is no doubt. This is neutrophil. Look at the three segment of the nucleus. 1, 2, and this is the third one. So this is a neutrophil. And what are these cells which are in a very high number? Which are these cells? See this.
RBCs.
Erythrocyte.
Exactly. These are RBC or erythrocyte. RBC or erythrocyte, and this small clump, they are the platelet. Okay, they are also known as platelet. This one. Let's move on. Look at this. Another one. These are again different RBCs. This is a clump of the platelet. This is a very good slide which is showing different types of neutrophil here. So please take a bit of time and see this carefully. This type of questions are very commonly asked these days in the exam, in a computer-based exam. Okay, see there. This neutrophil has 1, 2, 3, 4, and 5 segment on the nucleus. It has 3, 1, 2, 3. It has 1, 2, 3, and 4. There's a small constriction, so I can consider this as a two segment. Okay, and 2 segments are here, and it doesn't have any segment. It is like a band cell. Okay, this is called band cell. So this is the most immature form of the neutrophil, and this is seen in peripheral smear in severe acute bacterial infection. Severe acute bacterial infection. I can give you many different examples here, like acute pyogenic meningitis, acute bacillary dysentery, acute pyelonephritis, acute osteomyelitis, acute lobar pneumonia. Okay, so any type of infection example you can give here. Okay, so these are different other stages of the neutrophil. This is becoming mature now. See this? This is mature neutrophil. This is also mature neutrophil, and this is known as hypersegmented neutrophil. Hypersegmented. If the neutrophil is having 5 or more segment in the nucleus, it is hypersegmented neutrophil. Now, can you tell me in which situation hypersegmented neutrophil is seen? Which situation? Which condition?
Sudden megaloblastic anemia.
Excellent. This is megaloblastic anemia. Very good answer. Megaloblastic anemia, which is caused by vitamin B12 and folic acid deficiency. You will see hypersegmented neutrophil as one of the feature in peripheral smear. Other features are they have megaloblast inside the bone marrow and macrocyte in the peripheral circulation. Okay, now look at the how eosinophil looks. So it is a granulated type of WBC. It has granules and it is a bilobed nucleus. Okay, there are 2 lobes in the nucleus. The nucleus of the eosinophil is stains purple and usually contains 2 segments connected by a thin chromatin filament, which is right there in the middle. Cytoplasmic granules are large and they stain red or orange with right stain. So this is eosinophil. So how to identify it? Just look at the granules and look at the bilobe nucleus. That's it. And it is slightly pinkish type. A bluish type is basophil, a pinkish type is eosinophil. Now, this is a basophil, which cytoplasm contains mainly dark purple granule. Now, this purple or blue is actually depends on which stain you are using. This is a right stain, but sometimes we use hematoxylin and eosin stain, so a bit of a different type of visibility or vision would be there. That often obscures the nucleus. The basophil constitutes 0 to 3% of normal adult white blood cell. Now, if you pay attention here, there is one big difference between eosinophil and basophil. I cannot see the segments of the nucleus properly. They are hidden by the granules. Whereas in eosinophil, it is seen very clear. In some other picture, they may show like it is also having two segment of the nucleus, and it is slightly bluish in color. So that's why I mentioned like that. Now, this is a slide which is showing lymphocyte. Okay, lymphocyte. Lymphocytes usually have a rounded nucleus. Okay, rounded nucleus. This is a bit confused with monocyte because it's a kidney-shaped nucleus. Okay, kidney-shaped nucleus. And sometimes if we are confused, we can do certain other types of cytological analysis. Now, lymphocytes can be of 2 types, T lymphocyte and B lymphocyte. T lymphocytes are slightly larger than the B. This is a very basic topic. Okay, so let me go a little bit quickly here. These are the different types of WBCs now, which are shown in one film. Okay, this is a very good slide. Now, just pay attention here. You should answer which type of cells are they. Okay, so which types of cell is this one? Yes, this is what?
Band cell, sir, young neutrophil.
So the band neutrophil.
The band cell.
Neutrophils in early stage.
Excellent.
Band neutrophil.
Excellent. Everybody is picking it correctly. This is a band cell. This is a young neutrophil. This signify there is a serious bacterial infection or acute bacterial infection. Now, what is this one? Just focus on this cell now. Yes.
Neutrophil, sir.
Neutrophil.
Neutrophils.
Very
Neutrophil.
good. Very good. This is mature
Neutrophil.
neutrophil. This is mature neutrophil. See there? 1, 2, 3 segments. So this is mature neutrophil. What is this cell now, which I'm showing here? Which is this?
Lymphocyte.
Lymphocytes.
Lymphocytes and lymphoid.
Very good. This is lymphocyte. This is a clear-cut lymphocyte, a rounded shell with a big nucleus. The cytoplasm is very small in case of lymphocyte. Now see this cell? See here?
Monocytes or monocytes?
Monocyte. Monocyte.
Excellent. Excellent. This is monocyte. This is a big cell and a kidney-shaped nucleus. So this is monocyte. Now you should not get confused between lymphocyte and monocyte. Okay. Now we have got 2 cells left. So look at the granules here, a little bit pinkish type of granules and bilobed nucleus. So which cell is this?
Eosinophil.
Eosinophil.
Exactly,
Yes.
eosinophil. This is eosinophil, and the last remaining cell is a basophil because I cannot see any segmented nucleus. Okay, and it has also got big granules, and it is a little bit bluish stain here in this case. So these are the different type of WBC. Sometimes the examiner simply asks this type of question just to make sure whether students know the basic things or not. Now, here these clumps are the platelet clump. See look at this clumped area. These are the platelet. Okay, or thrombocyte. Platelets appear like this in the peripheral smear. These bigger cells are the RBCs. Okay, and this is a type of monocyte. So though the typical kidney-shaped nucleus is not seen, it has only a small gap on one side. So I think this is a type of monocyte. Now these are neutrophil, basophil, and activated lymphocyte. You can see here, this is neutrophil. There's no doubt about it. This is typical basophil, and this is the activated lymphocyte. When lymphocyte is activated, it changes its shape. It is no more rounded one. Okay, that's why it is shown like this. Sometimes it may be confused with monocyte. I accept, you're a little bit confusion, but if there is confusion, a good student will answer. I use some other way to differentiate them. Please mute yourself. Now, this is neutrophil and monocyte. So this is neutrophil, no doubt about it now. And this is monocyte, a little bit kidney-shaped nucleus, a little bit. Okay. And these are the RBC, and these clumps are the platelet. These clumps are the platelet clump. Now, one very important concept, okay, all of you please follow here carefully. This is known as toxic granulation inside the neutrophil. Normally, neutrophils, is not look like this. Okay, if there are multiple granules or bigger looking granules present inside the neutrophil, it also signifies there is serious bacterial infection in the body. So band cell and toxic granulation present inside the neutrophil signify this may be a case of acute bacterial infection. Now to discuss this in a bit of detail, so let's talk about it now. Peripheral white blood cells are divided into 2 categories roughly. First is granulocyte, and among them, neutrophil, eosinophil, and basophil are the types. So neutrophil is usually seen in acute inflammation or infection, and they are the first line of defense. Whenever there is entry of any microorganism, neutrophil will reach there and try to neutralize that. They may be band cell, they may be segmented, or they may be hypersegmented. Every student know that now. Eosinophil are the cell in case of allergy. Whenever there is allergic response, eosinophils will be found. And whenever there is parasitic infestation, eosinophils are seen in increased number. So see there. So if your teacher asks you what are the causes of high eosinophil count in the blood, you can think of these causes: parasitic infestation and different type of allergic reaction. Basophil, okay. Basophil is also a type of granulocytic cell, which is seen in severe allergic reaction again, but mainly that allergy is a type 1 hypersensitivity reaction. And in that type, histamine play a big role. Heparin is also released inside the, it is present inside those granules, and it may also be released during the reaction. So these are the different granulocytes you can see in the picture. Okay, here. Now, the second type of WBC are agranulocyte, which doesn't have any granules inside, and they are lymphocyte and monocyte. Now, neutrophils are segmented neutrophil, which are called mature one, and they are the most common types of WBC present in peripheral blood. There's no doubt about it. Other are band neutrophil. They are the immature form, and there is one term I like you to note here. It is left shift. Left shift means if there is a majority of neutrophil which are band type or immature type, we call it left shift. Means it shows a serious type of infection in the body. That type of terms are very commonly used in peripheral smear interpretation. These are the different stages of neutrophil maturation. In the beginning, they are called blast cells, then progranulocyte, myelocyte, metamyelocyte, band cell, segmented neutrophil, and in some of the disease, they even become hypersegmented. So blast cell, okay, progranulocyte, myelocyte, metamyelocyte, band cell, segmented neutrophil, and hypersegmented one. In some hematological malignancy, especially the acute type of leukemia, these blast cells are very, very high, okay, in number. They are in increased percentage, either lymphoblast or myeloblast, according to the situation. Now, right now we are talking about neutrophil. So neutrophil blast cells are increased in myeloblast leukemia, not in lymphoblast, okay? I'm just explaining the meaning of blast there. Nucleus is a parallel border here and looks like a sausage shaped. So in case of band cell. Now, band versus segmented neutrophil, okay? I don't need to explain this further because you already know how to identify them. Very clear picture. This is a band cell and this is a segmented neutrophil. Now, the second most common type of WBC in peripheral blood is lymphocyte. Okay, we don't worry about this animal. Okay, bovine is animal, cow, isn't it? We are talking about the human being now, so let's ignore it. These lymphocytes are round to oval or slightly indented nuclei sometimes. That's why sometimes they are confused with monocyte. Okay, and if you are confused, you can answer, I'm confused between this lymphocyte and monocyte because sometimes even lymphocyte nucleus is slightly indented, but in comparison, monocyte looks bigger and the lymphocyte. If you answer like that, your examiner will definitely accept the answer. So they are predominantly round cell, slightly smaller than the neutrophil, but they can be medium and large, and when they are activated, they change their shape. They are no more rounded after the activation. Monocyte are the largest cell among the WBC. Okay, they are the largest cell and they are not in very high number in the peripheral smear. And when they are present in the tissue, we call them macrophages. Now, These are the different morphology of the leukocyte. Okay, you have seen this so many times. Here is eosinophil. These are the eosinophil. See that, look at the different stain. According to the stain, it looks a bit different, okay? But don't get confused. It still has got some granules here. These granules are not commonly seen in neutrophil. This can be confused with neutrophil, but neutrophil usually doesn't have granules until and unless it is a case of severe bacterial infection where there are toxic granulations present in the neutrophil. But there are some other clues also. This is a clear-cut case of basophil. This is a basophil, no confusion, typical basophil. And these are the lymphocyte. Okay? Lymphocyte. This is activated lymphocyte.